Welcome and thank you for joining us for the first in a multi-part recorded discussion series, Inequity in Care, Stories and Insights in Alopecia Areata. My name is Nicole Friedland. I'm President and CEO of the National Alopecia Areata Foundation, NAAF. And I'm joined today by Dr. Brittany Craiglow, a U.S.-based dermatologist specializing in hair loss and complex skin conditions with a strong commitment to patient care, research, and education. Elliot Rosen, a high school senior who first noticed signs of hair loss in third grade and will share his journey as a patient with alopecia areata, and Joanna Rosen, Elliot's mother. As well, Georgia Van Cuylenburg, an actress, advocate, and individual living with alopecia areata, dedicated to youth empowerment and raising awareness for the disease. Across this series, we'll examine diagnosis, treatment access, and broader barriers to care and ways forward to improve patient outcomes. In this session, we'll focus on the critical first step, understanding the challenges of receiving a diagnosis and what this then means for accessing appropriate treatment and support. To begin, let's briefly introduce alopecia areata. Alopecia areata is an autoimmune disease that causes unpredictable and often sudden hair loss, ranging from small patches to complete loss of hair on the scalp and body. Frequently dismissed as a cosmetic condition, alopecia areata can be a deeply traumatic experience, resulting in emotional, economic, and social impacts. Despite its significant impact on patients' lives, the disease is often misunderstood and overlooked, both by the public and within the medical community. The fact that alopecia areata is dismissed as a cosmetic issue often leads to delays in diagnosis. Today, we'll explore these barriers through lived experiences. Let's get started. Could you share your experience, Joanna, starting with you, from when you first noticed symptoms in Elliot to the diagnosis?
Sure, it's been a long journey. His first symptoms started back in 2016 when he was in third grade and was actually noticed by his barber, who, as he razored down the back of his hair, noticed a spot. Those spots came up with more frequency over the next 2 years, to a point where I had met with his pediatrician during that time, who said it was just stress. But it got to the point where it was not possible. He was not stressed out. So we started going at the suggestion of a friend of ours who had a daughter with alopecia areata. I contacted them, and they told me about the process that she was going under. So we started with injections, and that went on for about 2 years with increased frequency. So the dermatologist agreed that it was time to step it up and shift course. So we saw a specialist, a pediatric specialist, started on an oral medication for a real short term, but that had to stop because Elliot had surgery for his elbow. And at which point, over that course of a couple of weeks, the hair was falling out all over the surgical bed, and did a lot of research actually while he was under anesthesia. And I discovered Dr. Craiglow that way. So we called her office, and the rest is history.
So I'm really hearing a consistent theme. It took many doctors, many visits to different doctors, and also a dismissal that what you're experiencing is from stress versus an autoimmune disease. All right, so following the worsening of your symptoms, Elliot, let's go with you. Did you find that you were treated differently by people around you, and how did that make you feel?
As someone who was in middle school at the time when my hair started rapidly falling out, I noticed right away that I was getting these looks, and that people were telling me that something was different with me. And I, at the time, didn't like accepting the fact that I was going through something that wasn't necessarily normal. But hearing it from other people really affected me, and really impacted like my confidence and my ego at the time. And it was sky high in middle school. So it was difficult for me. And because of COVID at the time, I was able to go online, but it was still difficult when people texted me asking me if I had cancer, asking me if, like, why I was bald, or like questions like that. And it was just, it was just very different for me.
Yeah. And Georgia, you experienced it as a grown-up with a career. How did it impact you?
Well, for me at the time, so much of my appearance was tied into how I made a living and looking a certain way. I was a hair model. And so to lose that one thing that I said the only thing I like about me is my hair. And it was tricky because so many people, we're talking 2007, there was the old school mentality, if you can't tell anyone, you got to keep it a secret, it will ruin your career. And so I believed them for a year and wore a terrible wig and a hat. And I was doing stand-up comedy. You can't wear hats when you do stand-up comedy. So people just told me things that weren't true to how I really wanted to live my alopecia areata. And that first year keeping secrets was the worst year of my life.
I'm curious to know if there were aspects of your disease that affected your day-to-day life.
I would say that the largest part that about this disease, about alopecia areata, that really affected me was how, like, yes, I was treated differently by my friends, but it's how I treated myself differently. So baseball has always been a major part of my life, and when I broke my elbow in 8th grade, I was unable to, like, play in the games, of course, and I was losing my hair, and I love baseball and I wanted to go support my team, but I didn't let myself because I didn't want my friends to see me the way I looked, and I limited myself from that. And so I kind of isolated myself from everyone else because I was not just worried about what they say to me, but I was worried about what I was showing them about myself.
Yeah. Elliot, thank you for talking about the sports as well. That's something, like, there's so many moments in our day that we don't think about. When you have hair, you don't think about what it's going to be like if you don't, and making a choice. Do I want to run today with hair? Do I want people to know I'm bald today when I'm running? I had to run a marathon with a wig on because I wanted to take photos at the end, and I hadn't. These kind of moments, it makes life harder in every way.
Dr. Craiglow, what do you see with your patients?
Yeah, I mean, I think all of this is so true. It's really easy. I think everybody with alopecia areata has heard, oh, it's just hair, right? And I often say it's easy to say it's just hair until it's your hair or your child's hair or your family member's hair. And I think, as you've sort of said, it's kind of impossible to interact with the world in a normal way when you don't have hair or you're missing hair, right? And even if you're doing things to camouflage it, you're worried that people are, thinking about that, right? And we often hear, oh, well, at least he's a boy. You probably heard that with Elliot. And I think, again, that just comes from this place of misunderstanding, right? I think, socially, it's a lot easier for a woman to wear a wig or to draw on eyebrows and do these sort of camouflage things that can make you sort of feel a little more normal, whereas males, that is actually a lot harder, right? So I think, again, it's so difficult. Like every interaction you have with another person, you're thinking about it, right? And there are so many things that we take for granted, like we go swimming. Well, a lot of people with alopecia areata won't go swimming. I have patients that won't go to the pool party, right? People at work, colleagues are worried that they're sick, so they're treated differently. They might not even put themselves up for a job because they're worried about what people might think, right? It's kind of hard to escape. And, even when you're at home, you walk by a mirror, right? You're reminded constantly of this disease that, can really sort of steal your identity.
So one of the things that I've heard from many of our community members is that they make themselves small. So like at work, they will not stand out. They will sit in a corner. They will not speak up. In meetings, they will not go for promotions. And it's really painful to hear that, to think about making yourself small at school or at work or with friends or dating so that you won't be noticed. So that's something that's been really impactful for me to hear from the community. As well, there are studies that show that this is so traumatic. Even after you grow your hair back, you're still traumatized. It doesn't just go away. You still have alopecia areata. So on that note, alopecia areata, when was the first time you knew that that's what you were experiencing? Did you know what alopecia areata was before this happened? Georgia, you want to start?
Yeah, I was fortunate that for so many people they get misdiagnosed and they get told all sorts of wild stories about what it could be. I was fortunate I got the correct diagnosis immediately. So that's great. But it also came with a hopelessness because had it been another diagnosis that was potentially something that could come back, then you're like, oh, okay, it's just a momentary thing. But I was told it's alopecia areata. It's just going to keep happening and get used to it.
And when you were told that, did you know what alopecia areata was?
I'd never heard of alopecia areata when I got the diagnosis. I had no idea. And I had so much hair, and hair was such, as I said, part of my identity that it just felt like an attack on me at the time.
And Elliot and Joanna, had you heard of alopecia areata?
I mean, so of course, I was in third grade when the patches first started happening, and I would say that I didn't necessarily kind of realize what was happening to me up until when we had our first set of injections, and I was like, okay, something is different here, and so that's when I kind of noticed. But I feel like my mom can speak more to the actual diagnosis itself and how that came to be.
Yeah, I don't remember the first time if a doctor actually said alopecia areata. I was like a mad behind the scenes researcher trying to figure out, going on every database possible to try to understand what was going on. In terms of, I just want to mention, like, the medical trauma piece of it was definitely for Elliot. It was very much so for myself. After the fact, my daughter, my son mentioned how difficult it was for them because something's happening to my child, totally out of our control. And the impact socially, I mentioned that before, academically, the shell was essentially, it culminated when Elliot said to my husband and myself, I can't go to my high school bald. We started looking at smaller schools. And he said, I can't go back to that school bald. I don't even know if you remember this. And we found an environment, we went to a private school because he felt the most comfortable there, and we would have done anything we needed to do to have him be as comfortable as possible.
And this feeling of helplessness, I think, fortunately you were fairly quickly able to, get a diagnosis, but I think that's really different for so many people living with this disease where they maybe don't have access to a dermatologist, or they go to see maybe their primary care physician or a pediatrician who does sort of chalk it up to stress, or, oh, it's not a big deal, or, maybe the barber cut it too short. And so they are out of control in this thing that's happening to them, and they can't even have an answer, or the person they're looking to for help to sort of regain control or fix this is also not helpful, right? So it becomes this kind of vicious cycle of, of trauma and lack of control and disappointment. And I see so many patients where I am maybe the fourth or fifth or sixth doctor they've seen, some of whom they've already seen dermatologists, right? But they've been told, I'm sorry, there's nothing to do. Or they've been told, oh, well, at least it's not cancer. Why don't you play with wigs? And these are, again, from healthcare providers, people, that patients are looking to for help. So I think, while there is improved awareness, we have a lot of work to do still in helping recognize the disease, getting that early diagnosis so that people can start to access treatment.
And as a patient, also, when you call to get an appointment with that dermatologist that you've been told will be the answer, and you're told, sure, they can see you in 6 months. And you're like, but I just literally lost half of my hair in the last week. I've only got another week before it's like that time that you have to wait, and you don't know like how many hairs are going to fall tomorrow and the next day. We don't have time.
So Dr. Craiglow, you mentioned some other very serious diseases, and we now know that alopecia areata is an autoimmune disease. Why do you think it's still dismissed by so many as a cosmetic issue?
I think probably a lot of reasons. I think the main one is that it's still very poorly understood among physicians in terms of what the patient experience is like. But we also have to remember hair actually has function too. Like patients with alopecia areata often are missing eyebrows and eyelashes. We have those for a reason, right? They keep things out of our eyes. A lot of patients with more severe disease are missing nasal hair. They get, allergic symptoms more commonly. So there is this function to hair too, right? But I think, cosmetic to me means looking to enhance one's appearance, right? People with alopecia areata, you're not looking to enhance your appearance. You just want to look normal. The goal of treatment is just to restore normal. And if you think about a lot of things that we do in dermatology, that's also the goal, right? Psoriasis that's not itchy, well, is that cosmetic when we treat that? No, we're making the skin normal again. Same for acne. I mean, there are so many examples of this. And I think because it's hair, somehow it feels different, right? And I think also part of that may be because we sort of historically haven't had reliably effective treatments, right? And so among healthcare providers, there's this feeling like, well, if there's nothing I can do for it, that doesn't feel good. And so maybe in my mind, I just dismiss it as not really a big deal, right? So I think it's kind of complex. But I think, even though there are now, approved therapies, there is still this idea that, oh, well, that's not something worth treating. And that's really unfortunate.
Do you think these persistent misconceptions delay primary care providers from helping their patients see the right specialist?
Yeah, oh, for sure. And I think even, when patients do see a dermatologist, sometimes there is that attitude as well. And then, if you're a primary care physician and you've sent a patient to a dermatologist who has said, oh, I'm sorry, there's nothing to do for you. Well, the next time you see a patient, maybe you're not going to refer them to the dermatologist because you don't actually know that there are options, right? And I see, so many patients who have seen, you name it, physician, primary care physician, endocrinologist, rheumatologist. I mean, oftentimes they don't even get to a dermatologist until a few, practitioners in, right? And then even then, they are either told there's nothing to do, they're offered only injections, maybe some topicals, which we know really aren't effective, especially for people with more severe disease, right? And so this is happening, and that word kind of gets back to the person who's putting the referral, and you can see where this is this cycle of patients not getting effective treatment.
When you mentioned with the primary care physician, when we first went to Elliot's pediatrician, it was dismissed. And I actually stopped going for a while. We went for his well visit about a year later, but I was really frustrated until it got to the point with his eyes. He is somebody who I went back to, but not with Elliot. And I just showed him photographs. And, kudos to him. He gasped and he said, oh my goodness, why didn't you tell me? And I said, it's because you dismissed him. When we first came to you, you dismissed him. And from that moment on, really, I was very grateful. It was a little late in the game, but he started doing research. He called me with names of all of these different specialists to make sure that there wasn't something else going on. But it really just took his realizing and being told that he really changed his tune. But it's really misunderstood if it's not so severe.
So we've really established the journey to diagnosis is challenging, right? You've shared your stories, you've shared your patient stories. We see this all the time at NAAF. I'd love to hear ideas on how we can improve the diagnosis journey for other patients, for future patients.
It would be so amazing if those general practitioners just had alopecia areata presents like this, your options are this, and more dermatologists could specialize in it because it's the backlog of great dermatologists like yourself. Not everybody can go to Dr. Craiglow. We need more doctors that have that information.
I'll add on to that. We at the National Alopecia Areata Foundation have a lot of resources for patients, and more because we have a changing treatment landscape. So we've been working very hard to get new materials and resources on our website and in our webinars. Dr. Craiglow has been featured in some of our webinars. What we hear from our community is they are usually more informed about alopecia areata, not only than their primary care providers, but then their dermatologists, which is really something that we have to change.
Yeah, I think that the whole idea of early identification can only happen if there's information and education. And I think also for parents, it is so important to recognize the impact on yourself and that it's just not known enough. The information and the education and the sensitivity that Dr. Craiglow brings to her work is what I hope all dermatologists, pediatricians, all healthcare providers, all hairstylists. I really think that it's a hairstylist thing too, because if it weren't for that first barber, I would have no idea what was going on.
Yeah, I'd love to hear any ideas of ways you think patient advocacy groups can help close that gap to diagnosis.
Sharing stories. I think everybody when you hear someone else's story and you hear yourself in that story, it really makes you feel less alone. That isolation, that feeling alone, when we don't know we have an option, we isolate. But it is so powerful, even with people that have different conditions. Everyone has their alopecia areata, whether it's hair or something else. Being brave enough to take the first step to share, you just never know who's out there that needed to hear that. So I think the more we as a community can encourage all of us to have that brave moment to tell our story, I think it's super exciting what we're doing, advocating on Capitol Hill, trying to educate decision makers and people that have power, how impactful, how tricky, how messy this is. It's not just hair. It's so important because there's so many tactical things like wigs being approved or the steps we have to go through to get treatment that need to change. The more we tell our stories, all of that becomes possible.
Yeah, and I think I think the most important part about that is just overall comfort with yourself and with being able to share your story. I think it takes a lot to do because it's being vulnerable, and I think just people just need to be a little more vulnerable now. Like people need to know and like be comfortable with themselves and being able to show their true selves to others in order to share their story and spread the awareness.
The more I spoke to parents, and I think it's not just those who are affected. I think luckily the mental health landscape is changing completely. But I mean, I fielded calls from people I've never met before because somebody who I know happened to be at an airport, who happened to see somebody there who looked as though, a child with possibly alopecia areata, and then they gave their number to me to call, and local people. There's a network that you find and they then tell their friends. I don't think it's any different from it's not any different from any other disease when you're the one being impacted or it's somebody you know is being impacted.
Elliot, will you share a little more about how having alopecia areata affected your day-to-day life?
Yeah, so I mean, as someone who's in middle school at the time, people aren't at the point where they can kind of realize that some of the things that they're saying could be more hurtful than what they think they're saying. Like even if it's just a question, like getting texted after a school day, like why do you look that way, or just being told like why does it seem like you have cancer? Are you dying? And like that really affects me and made me start to really think about myself and question my own appearance. And I think one of the most pivotal moments for me was at my 8th grade graduation. And this was after almost a month of online school because I lost almost all my hair. And I was wearing a hat at the graduation. And one of my teachers, and I remember her so well because she gave me this science award. She was my science teacher. And she didn't have to do that. I wasn't the strongest science student, but she did it because she wanted me to know that I was still like a human. I was still like here. I was still present, and she like did it so I would remember this moment and remember the fact that like I'm normal Like, and I think that that was one of the most important parts, was just having someone at school tell me that everything's going to be okay, and that like they still appreciate me for myself rather than for the person I look like.
In terms of closing the gap from symptoms to diagnosis, I think patient advocacy groups like NAAF have a big role to play. We really need to raise awareness about this disease. It's very interesting that so many people know other diseases with far less prevalence, but they don't know alopecia areata, and they don't know that it's an autoimmune disease. So I think that's one of our jobs ahead of us, is raise awareness, reduce stigma, help the world understand it's not just hair, it's an autoimmune disease. I think that will speed up diagnosis. Joanna, as a mom who's been through this experience, what advice would you give to other parents who are just starting to have symptoms of alopecia areata with their child?
I think something that I would say, that it's okay to not be okay. And that's something echoed that what you said before, that it is really difficult to see something happening to your child that you personally can't control. But with that being said, what is controllable is the approach and what you do about it, in the sense of just don't stop, climb the ladder in specialists, and just find the person who truly can speak to you in a way where your gut says, okay, now I'm ready to listen. And for us, again, that was Dr. Craiglow, once it got to the point where it was so out of control. I think that we had really wonderful providers along the way with limited information. And I was okay with that, knowing that just because they didn't have the information didn't mean there wasn't information. It just finding the right people. So it's okay to not be okay yourself. And it's important to know that it's not okay for your child. And then you just go from there.
Thank you. Dr. Craiglow, what advice would you give to parents?
Yeah, I mean, as parents, we will go to the end of the earth for our kids often, right? But I think if you don't sort of know what that is, then you can't get there. And if the person you go to tells you you're already there, you maybe just accept it, right? So I think it's important for parents to have information, to be armed with that information, to be able to advocate for their child, to be able to ask questions. And if they are with a provider with whom they don't feel comfortable, or who maybe doesn't have knowledge of the types of treatments that they're looking for, have that provider help you find somebody else.
But I think that it's very easy for parents to just hear what a provider says and just take that as fact, and it's not always fact. So it's not that it's not always fact. Just because someone, I think I mentioned this before, just because someone doesn't have the answer doesn't mean there isn't an answer.
In terms of like from my perspective and from what I went through, I think it's really important to know your child. What I wanted at the time was just to be treated normally. And then there's going to be other kids that want to be heard and want to know that they're not normal, but that's just what they need to hear. So I think it's really important to just understand the point of view that your child is coming from, and kind of just really observing their like their ways as they're going through this, and so you can better understand what they need from you.
We often say, follow your kids' lead. Georgia, I know you work with a lot of children and parents. Do you have some advice?
You took the words out of my mouth. Every parent, when I meet them, so often I feel like they're trying to take the journey for their child and make decisions. The more I have seen the child define the journey, like today I want to try a wig, tomorrow I don't want to have a wig. Today I'd like to try a hat. Today I want to be bold. Whatever the child wants, within the love and the care of being that protective parent, don't walk them down a path that's unsafe. But I often, when injections were the only option, I sometimes really had to ask a parent, do you know how much that hurts? And I really wanted to ask the parent, like, is it you who has alopecia areata or is it your child? And you need to engage them in that. Like, how much is this hurting?
One other thing I'll just add for parents, I think it's tricky, right? Because we want to reinforce coping, because coping is a useful life skill, obviously. But I think sometimes in doing that, the message is that, it's not okay to feel how you feel. So I hear oftentimes, oh, but he doesn't really care, or she doesn't want hair anyway, and she's still beautiful. And, from parents. And when you're a child and you're potentially feeling, having a really hard time with something, but that's the messaging you're getting from your parent, who you really don't want to let down, you sort of keep those feelings inside, right? I have a patient who is now an adult, and she said, I just didn't say anything because I didn't want to upset the people around me. So kind of finding that balance between, yes, coping is useful, but it's also okay to be really angry or really upset or depressed or have anxiety. Like, those are all normal feelings, right? So that kind of validation, I think, is really important. But especially with younger kids, I think you sort of wait to see how they feel about it, and then you validate that.
I think it's both a blessing. I'm going to say it's a blessing, although at times it may be a curse. I'm a psychologist, so I'm very attuned to nonverbals. So that's, for me, the communication that I always was looking at, both from Elliot to the world and the world to him. And that's how I really created this behind the scenes approach, I would say, to just put him in the best position possible to thrive, not knowing what the future was going to look like for him.
I think the empowering part, each in their own journey. Just like Nicole said, it's so important to feel all the down feelings with that empowerment.
Yeah.
Something that I've found really special is when you can help a young person see how their difference could help others.
Okay. Dr. Craiglow, Georgia, Elliot, and Joanna, it's been such a pleasure having this conversation with you. Thank you for sharing your insights, your personal journey. Dr. Craiglow, your patient's experiences. I think we've really shown this is an autoimmune disease that is still deeply misunderstood. It has intense social, emotional, and sometimes economic pain. There's still a great distance and a lot of work we have to do to help close the gap from symptoms to diagnosis, so that we can help people starting an alopecia areata journey more quickly access the medical care that they need.